Welcome at Patient Better. In this video, we are going to address the market gap that the electronic health record has created and how healthcare management education has become a resolution. When the electronic record management system was initially created, the developers believed that information outside of condition-related education should be self-learned by the patient, under the assumption that this would allow clinicians and consumers to focus on diagnosis management. However, the average health recipient was not privy to this information, and the outcome of this philosophy was that rather than people becoming proactive in learning, they became more reliant on the clinic to govern their medical information. The practice of excluding unreimbursable education was established over a decade ago. And now, current research shows that neglecting to teach health management education to people left 80 million Americans unwittingly suffering from healthcare illiteracy, and its outcome is believed to cost the U.S. healthcare system between $106 to $238 billion each year. Health management education resolves the electronic medical records market gap by educating people on the essential health management training that will direct them how to participate in treatment, have fewer complications, reduce emergency room visits, prepare for information-driven medical appointments, and reduce unforeseen costs. Health management will also teach people how to discern proper medical utilization, which helps patients identify the importance of appropriate preparation of medical appointments to reduce unnecessary phone calls and office visits, as well as effectively take advantage of offered services, treatments, and resources. Health management will also teach people how to improve risk management skills, to have a realistic calculation of services needed for proper treatment and the necessary financial proficiency to make more informed healthcare decisions. And health management will also teach people how to effectively manage care records to become an efficient and effective liaison in the transfer of information from one physician's office to the next. The outcome of health management learning will improve the health consumer's experience, adaptability, and application of learning throughout your point-of-care services, which will ultimately get your patients to become proficient in medical record governance. They will have the ability to manage multiple conditions and specialists. They will have the knowledge to engage in higher quality treatment. They will have more competency to perform more sophisticated at-home care, and increase their capability to comprehend and follow a higher level of communication. To learn more about how we can help your patients, family care teams, and caregivers become proficient in healthcare management or acquire your own location, visit us anytime. Thanks for watching.